Hello, welcome back to our series on the latest in joint arthroplasty research, Arthroplasty Focus. Today we will be summarizing several studies and reviews that have been recently published in the special issue Management of PJI SSI After Joint Arthroplasty, published on Arthroplasty. They cover a range of topics, from the prevention of surgical site infections to the management of periprosthetic joint infections. Let's get started. First, we have a review by Ricardo Souza on the optimal interval for two-stage exchanges in joint prosthetic infections. He suggests that an 8-week interval may be ideal, but emphasizes the importance of individual patient factors. Next, a review by Yves Gramlich discusses salvage procedures for severe periprosthetic joint infections. He underscores the need for careful patient selection and comprehensive preoperative planning. We also have a summary from Jiying Chen on the topic of articulating spacers. They discuss their various types, materials, and how to properly utilize them. Javad Parvizi presents a 10-step approach for preventing surgical site infections. Each step is explained in detail, and he emphasizes that consistent adherence to these steps can significantly reduce infection risk. Mark J. Spangel discusses the effectiveness of debridement, antibiotics, and implant retention in treating acute periprosthetic joint infection. He highlights the crucial role of patient selection and technique in the success of this treatment. Alex Soriano reviews the use of antibiotic-loaded bone cement for the prevention and treatment of prosthetic joint infections. He addresses the potential risk of antimicrobial resistance and calls for better carriers and different antimicrobials to improve clinical outcomes. LiCao reviews single-stage revision as a treatment option for chronic periprosthetic joint infection following knee and hip arthroplasties. He provides guidance on the indications and specific treatments for this procedure. Marjan Waldhuizenbacher explains the basic principles of antibiotic treatment for periprosthetic joint infection, stressing the challenging nature of such treatments and the need for a multidisciplinary approach. Sheldon Lin investigates the incidence and risk factors of surgical site infection after primary hip hemiarthroplasty. He identifies chronic steroid use, a high body mass index, and long intraoperative time as independent risk factors. Christoph Berberich discusses the evidence for using dual antibiotic-loaded bone cement to prevent prosthetic joint infection in high-risk patients. He concludes that this may be a valuable strategy, but calls for more clinical trials to confirm this hypothesis. Simone Natali compares two surgical methods for treating acute periprosthetic knee infection. He finds no significant difference in success rate between the two methods, but suggests the need for more randomized controlled trials. Tristan Ferry discusses a case of Coxiella burnetii prosthetic joint infection in an immunocompromised woman. He emphasizes the importance of proper management of such infections. J. N. Dornberg conducts a systematic review and meta-analysis on surgical site infection of wound closure using staples versus sutures in elective knee and hip arthroplasties. Anne Thunis-Fokkema discusses a case of rat bite fever in a patient with a total knee arthroplasty. This is the first reported case of rat bite fever in a total knee arthroplasty. M. Waldhuizenbacher presents the Ninja protocol for PJI treatment, which highlights the importance of interdisciplinary collaboration, accurate diagnostics, and adequate surgical experience for successful treatment of PJI. Pingkeng Chan reviews the risk factors associated with surgical site infections following joint replacement surgery. Preventive measures should take a multi-perspective approach. Humza M. Mian reviews current practices in periprosthetic joint infection, debridement, and revision arthroplasty. He emphasizes the importance of early detection and proper management of periprosthetic joint infections to improve patient outcomes and reduce the need for revision surgery. A paper from Yixin Zhou and colleagues at Beijing Jishuitan Hospital, focusing on the importance of managing soft tissues in PJI treatment. Next, a review from Jason M. Jennings and his team at the Colorado Joint Replacement Center discussing the challenges of diagnosing chronic PJI due to the lack of a single gold standard test. Finally, a review from Saksham Tripathi discusses the use of novel biomarkers for improving the diagnosis of PJI. That's all for this episode. We hope this summary of the latest research helps you stay up to date with the developments about PJI in joint arthroplasty. We would like to acknowledge the guest editors for this special issue, especially the leading editor, Professor LiCao and Professor Javad Parvizi, to organize this creative issue on our journal. Welcome to read the articles and find more details via the website. Thank you for watching.